Imagine this. You wake up in the morning and your fingers feel tingly, your feet are ice cold, and you're just feeling blah, even after a full night's sleep. We often brush these things off as no big deal, right? But what if I told you they could be signs of something more serious, like poor circulation? Our circulatory system is like the delivery system of our bodies, responsible for transporting oxygen-rich blood, nutrients, and even hormones to every single cell. When it's working properly, we feel energized, our organs function optimally, and we're generally healthier. But when circulation is compromised, it's like a traffic jam in our blood vessels, leading to delays and frustration. The good news is our bodies often give us warning signs when something's not quite right. In this video, we're going to dive into 5 common signs of poor circulation that you should never ignore. We'll talk about what those signs mean, what might be causing them, and most importantly, what you can do about it. Let's get started. Have you ever been in a room full of people and everyone seems comfortable, but you're bundled up in a sweater, socks on, and still can't seem to get warm? Specifically, your hands and feet are always cold, no matter the temperature. This is actually one of the most noticeable and common signs of poor circulation. When blood flow is restricted, our body prioritizes sending warm, oxygenated blood to the most vital organs first. Think the brain, heart, and lungs. That means areas farther away from the heart, like our hands and feet, might not get as much warm blood flow, especially when circulation is compromised. Sometimes it's as simple as the temperature outside. If it's cold, our bodies naturally constrict blood vessels in our extremities to conserve heat. But if you're noticing this consistently, even in mild temperatures, it could point to an underlying issue. One possibility is a condition called Raynaud's phenomenon, which causes blood vessels in the fingers and toes to overreact to cold or stress, leading to numbness, tingling, and color changes in addition to coldness. Other potential culprits include smoking, which damages blood vessels, and certain medical conditions like diabetes or thyroid issues, which can also affect circulation. If you're constantly battling icy fingers and toes, it's always best to chat with your doctor to rule out any underlying medical conditions. They can help determine the root cause and recommend the best course of action. In the meantime, regular exercise is like a workout for your circulatory system. It strengthens your heart and improves blood vessel function. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Let's talk about another common sign of poor circulation, that pins and needles feeling, also known as numbness or tingling. We've all experienced it at some point. Maybe you've been sitting in an awkward position for too long and your foot falls asleep. That temporary tingling is usually nothing to worry about. It happens when sustained pressure on a nerve temporarily disrupts blood flow. But what if you're experiencing numbness and tingling frequently, even without an obvious trigger? This could be your body's way of sending up a red flag for poor circulation. Our nerves rely on a steady supply of oxygen-rich blood to function properly. When blood flow is restricted, nerves may not receive the oxygen they need, leading to those uncomfortable sensations. Sometimes it's related to a compressed nerve, like carpal tunnel syndrome, which affects the wrist, or sciatica, which affects the lower back and legs. However, if you're experiencing these sensations more generally or in different parts of your body, it could be a sign of a systemic issue like poor circulation. Conditions like peripheral artery disease, which narrows the arteries in the limbs, can significantly reduce blood flow and lead to numbness, tingling, and even pain. So, what should you do if you're frequently experiencing numbness and tingling? Make an appointment with your doctor to discuss your symptoms. Early detection and treatment are key to preventing further nerve damage and improving your circulation. Now let's address another telltale sign of poor circulation: swelling, especially in the lower extremities like your feet, ankles, and legs. You know that feeling when your shoes feel a bit snug at the end of the day, or you notice your ankles looking a little puffier than usual? While it's normal to experience some mild swelling after standing or walking for long periods, persistent or excessive swelling can be a sign that something's amiss with your circulatory system. When blood flow is compromised, fluid from our blood vessels can leak into surrounding tissues, leading to swelling. This fluid buildup is known as edema. One of the main culprits behind poor circulation and swelling is venous insufficiency. Our veins have tiny one-way valves that help keep blood flowing back up to the heart. When these valves weaken or become damaged, blood can flow backward and pool in the legs, ankles, and feet, causing swelling. Other potential causes of swelling related to poor circulation include heart failure, kidney disease, and certain medications that can cause fluid retention. If you're noticing persistent or worsening swelling, try to identify any potential triggers and modify any lifestyle factors that might be contributing to the problem. However, it's crucial to see your doctor if the swelling is severe. doesn't improve with home remedies, or is accompanied by other symptoms like pain, redness, or warmth in the affected area. Let's talk about fatigue, that feeling of constant tiredness or lack of energy that many people experience. We lead busy lives, so it's understandable to feel tired sometimes. But if you're feeling exhausted even after a full night's sleep, and it's affecting your daily life, it's essential to pay attention. While fatigue can be a symptom of various conditions, one often overlooked culprit is poor circulation. Our circulatory system is responsible for delivering oxygen and nutrients to every cell in our body, including our muscles and organs. When circulation is compromised, this delivery system becomes less efficient, and our cells may not receive the energy they need to function optimally. Think of it like this. If your car's fuel filter is clogged, it can't deliver fuel to the engine efficiently, leading to sluggish performance. Similarly, when our blood vessels are narrowed or blocked, it's harder for blood to circulate effectively, and our cells may not receive the oxygen and nutrients they need to produce energy. Several factors can contribute to poor circulation and fatigue, including a sedentary lifestyle. When we spend most of our day sitting, our circulation slows down, and our muscles don't get the blood flow they need. Dehydration. When we're dehydrated, our blood volume decreases, making it harder for our heart to pump blood effectively. Poor diet. A diet high in processed foods, unhealthy fats, and sugar can contribute to plaque buildup in our arteries, restricting blood flow. So, what can you do to combat fatigue related to poor circulation? The key is to improve blood flow throughout your body, stay hydrated, eat a balanced diet, and get regular exercise. Finally, let's talk about varicose veins, those bulging, twisted veins that often appear on the legs. Many people think of varicose veins as primarily a cosmetic concern, but they can be a sign of a deeper circulatory issue, venous insufficiency. In people with venous insufficiency, these valves weaken or become damaged, allowing blood to flow backward and pool in the veins, especially in the legs. This pooling blood puts pressure on the vein walls, causing them to bulge, twist, and become visible through the skin. Varicose veins can cause a range of symptoms, including aching, heavy legs. The pooling blood can cause a feeling of heaviness or fatigue in the legs, especially after standing or walking for long periods. Swelling in the legs and ankles. As blood pools in the lower legs, it can leak into surrounding tissues, causing swelling. Itching around the veins. The increased pressure in the veins can also irritate the skin, leading to itching. Restless leg syndrome. Some people with varicose veins experience restless leg syndrome, a condition characterized by an irresistible urge to move the legs, especially at night. While varicose veins are often harmless, they can sometimes lead to more serious complications, such as blood clots. The pooling blood in varicose veins can increase the risk of developing blood clots, which can be dangerous if they break free and travel to the lungs, pulmonary embolism. Skin ulcers. In severe cases, varicose veins can lead to skin ulcers, which are slow-healing sores that can become infected. If you have varicose veins, it's essential to talk to your doctor to discuss your treatment options. They may recommend lifestyle changes, such as regular exercise. Exercise helps improve circulation and strengthens vein walls. Weight management. Losing even a small amount of weight can reduce pressure on your veins. Compression stockings. Compression stockings gently squeeze your legs, helping to push blood back up to your heart. Elevating your legs. Elevating your legs above your heart for 15 to 20 minutes a few times a day can also help improve blood flow. In some cases, your doctor may recommend medical procedures to treat varicose veins, such as sclerotherapy or laser therapy. Early diagnosis and treatment can help prevent complications and improve your quality of life. So, there you have it, 5 common signs of poor circulation that you should never ignore. Our bodies are constantly communicating with us, and those seemingly minor symptoms can sometimes be a sign of something more serious. By recognizing these signs early and taking action, we can often prevent more serious health issues down the line. Addressing poor circulation isn't just about alleviating those uncomfortable symptoms, it's about protecting your overall health. If you're experiencing any of the symptoms we've discussed, don't hesitate to reach out to your healthcare provider. They can help determine the underlying cause and recommend the best course of treatment for you. Take care of yourselves, everyone.